My name is Samantha Childs. I am the outreach program manager at Cochise Harm Reduction, and I help with operations every day, day to day. On accident. So I am a person who has a history of chaotic substance use, and I ended up going to prison. And when I came home, I had this, it's odd to say, but I had a wonderful parole officer, and she got me linked up with some services that I was required to do. And the people that were providing the services said, "Hey, why don't you come do your peer support?" So I did the peer support. And through that, I found a contracting position where I could give out Narcan. And then from there, I learned that it wasn't just Narcan. It opened up the whole world of harm reduction. And I mean, all I kept thinking was, I really wish I had had like access to this when I was a person who was using drugs. So our entire program is literally spent on meeting people where they're at. Back in 2022, we started building the routes. Lou, our executive director, already had Bisbee pretty much up and set up. I came in when we started to do Sierra Vista, and we decided where to go. We just went back to go visit people that we used to use with. Now we have routes in 5 different cities. We operate 3 to 4 days a week. And we go where people tell us to go. They use the hotline and they can say, "Hey, when are you coming to Douglas?" We let them know when we're going to be in town and we'll meet them wherever they'd like to meet us. It could be their house, it could be a wash, it could be behind a store. It's really just whatever they need. We have a really good relationship with our participants, and we've worked really, really hard to maintain the relationship. But outreach for us it's harm reduction, it's SSP services, but it's so much more. There's a really big need in our area to feed people, to help keep them warm, to link them to other services. It really depends on the person and what their need is. And we try to pivot as much as possible so that we can meet the need, because we're in an area where people's needs are like consistently unmet. The town where our office is located, which is Bisbee, is it's a very left town, so it's very easy to live and exist there. But when we go to certain areas where, like Benson, it's like the most northeastern area of the county, I believe, or northern area of the county, they want nothing to do with us. We're seen as the enablers. So we don't get a lot of support in those areas. We don't have very many community partners that we can reach out to, which really sucks, because when I have somebody who lives there and I need to link them to care, I don't have a number or a name in the back of my pocket, because we don't have we just don't have the relationships, because they don't believe in what we do. Yeah, we get the people that are like, "Oh, you're just enabling them. You're just giving them their syringes." And it's like, I was a person who used to inject, and I would reuse my works. And it is so much more than that, because when they're finally done, when they're sick and tired of being sick and tired, they're not going to call their health home and ask for help. They come to us, and we get them linked up with our girl, Vanessa. She takes the ball and she does amazing things with people. It really is prevention at the end of the day. There's a fulfillment, there's, prior to my drug use, I was a nurse, and I've always loved helping people. It's always been the thing that's filled my cup. Um, and I thought I lost that for a really long time. You can't be a felon and be a nurse anymore. And I was like, well, how can I still help my community? And so finding this has been a thing where it has surpassed anything that nursing had to offer, and it's helping in a whole new way. My favorite part of the route is the people. So most of my time these days is spent doing administrative work. Um, and while I love it, I'm just not an office person. I feel that outreach is the thing that fills my cup back up. It restores me. It brings me back in the hard days, um, as to why I do the work that I do, because it can be kind of daunting. So for outreach, it's the thing that centers me back into why I'm doing what I'm doing, but also filling my cup at the same time. I feel kind of greedy saying it. in a selfish way. I know it's about our participants, but it has to be about us too. Um, but yeah, it's the people at the end of the day. And just the route. The route is fun. The thing that I like least about outreach is I hate that there are not enough hours in the day to actually meet the need. As time goes on, we get busier and busier. We're a nonprofit, so that means that money is always going to be an issue, which means we have a very small team. And at the root of who we are and how we operate, it's all about the intention behind the work. It's got to be people over numbers at the end of the day. But when the need is so great and no one else is doing the work, it creates, I don't want to say a problem, but it's a balancing act. And it sucks because these people have come to depend on us. So that part's pretty rough. We have a lot of shut-ins. We have a lot of barriers. We lack a lot of access to services. And inside of that, it does complicate things. Like the worst problem in the world to have is, to be busy. It's great that we're busy, but when we start balancing out, how many people we need to see who truly need access to, like, and need our support versus what we have time to do, whether it's time within staffing hours or, whether it is supplies that we have on board. There's always a budget at the end of the day. And that part is really hard. The problem we're having now is the prioritization part. Because in my eyes, in most of our eyes, everybody is a priority. Everybody has a need. But when you have to start picking and choosing whose needs are more, it gets a little rough, and we don't meet the need. We're doing the best we can, and I think we're doing a great job, but it's like putting a Band-Aid on a bullet hole, and we're just not there. And I wish our team was a little bit bigger. That would be the thing I would change. If money and all that was unlimited and we could just do whatever we wanted, I would definitely, yeah, more great people like us though. Um, there's this whole rural versus urban thing, and I really truly think that I think that mobile outreach should be everywhere. But for us, more specifically, we are in a rural area, so for us, it's location, location, location. If you have somebody who's completely unhoused and they don't even have a phone and they don't have support of anybody, that's the next step. So can I expect you to come see me if you have to jump through a fire in order to do so? So let's cut the crap. How about I come see you? And now what we do is, even if we don't hear from our folks, when I meet up with you for the first time and I'm like, hey, this is great. Nice to meet you. Can I come back and see you the next time I'm in town? Sure. Do you want me to call you? Can you call me, or should I just show up? We always wait to be invited. We joke and say, like we're vampires. But we do. We wait to be invited in. We're never going to go where we're not welcome or haven't been asked to come into. But once we have been asked, we do make sure that we show up. We joke all the time about the exponential growth of CHR, where we went from 0 to 2 years, and, now where are we going to be in 3 years? Where are we going to be next year? What's going to happen in 5? And I see a housing program for us, or some awesome, like, literal no barrier shelter that's coming, because we need it. I think that's the most important part about, like, being around harm reductionists at the end of the day. Everybody's worked a 9 to 5 where you're just there to get your money to pay your bills to get out and go. But I have never in my life ever walked into a place where I have felt more of a sense of community and like-minded people than when I come to conferences for stuff like this, or even just a small group of us get together. You don't need to know them. Yeah, you don't need to know them because they're already like family. And there's a certain level of pride that comes inside of that type of work, that.